I'd like to have your attention. My name is Dr. Andrew Jacobson. I'm an assistant professor of GIS and conservation here at Catawba College. And it's my great pleasure to introduce to you, to moderate the Maps and Apps panel, and to introduce to you a group of amazing people who have helped create life-changing maps and applications. And really thanks to Jacoby Wilson as well for kind of being the perfect tee-up for this panel. So we have a mix of virtual and in-person panelists. So I'll introduce the the virtual ones first, and then our in-person panelists, and that will be the order of presentations as well, okay? So joining us virtually, we'll have Julia Kumari Dropkin and Dr. Rebecca Fry. Julia is the CEO and founder of IC Change. IC Change is a climate tech and data platform where a diverse group of users and stakeholders build change together. Dr. Fry is the director of the Institute for Environmental Health Solutions and the Carol Remmer Engel Distinguished Professor in Children's Environmental Health in the Department of Environmental Sciences and Engineering also at UNC Chapel Hill. And joining us in person here, we have Max Cawley, Eric Kloss, and Ron Ross. Max is the program manager of public engagement with science at the Museum of Life and Science in Durham, North Carolina, and Max helped lead the Urban Heat Island temperature mapping campaign in Durham and Raleigh last year. Eric is the CEO and founder of Daily Breath, a smartphone app to help manage asthma and allergy symptoms. And Ron is an airkeeper leader for the historic West End District in Charlotte, North Carolina, and the president of the Northwood Estates Community Organization, also in Charlotte. And so the panelists will begin by giving us a brief presentation on their map or app before we move into some moderated Q&A. And following that, we'll open it up to the community Q&A before having some closing thoughts from Jacoby Wilson. And so to begin with, although I can't see her, we will have Julia Kumari Dropkin. So Julia, please share your screen, and Dr. Fry will go second.
Can you all see me and hear me?
Yes.
Awesome. Okay. I am sharing my screen. I cannot share a screen while another participant is sharing. All right, here we go. It is amazing to see so many people together in person. This is wonderful and so refreshing. So it's an honor to be here with such great other presenters. I'm looking forward to the conversation. Again, I'm Julia Kumari Dropkin. I am founder of IC Change, and for 15 years, I worked for media outlets like the Associated Press, BBC's The World, and award-winning newspapers reporting on climate science and natural disasters. I covered the Asian tsunami and Hurricane Katrina in the same year. And over again, I saw the same problem. Top-down, well-intentioned solutions are failing to meet and keep pace with local climate needs. So I'm going to talk about IC Change, which we envision as a solution for data-driven collaboration. It involves activating everyday people to address the climate change together, modeling reliability and civic engagement, all in one fell swoop. But first, let me tell you why this matters. Not counting the Infrastructure Investment and Jobs Act here in the United States, the world spends over $5 trillion on infrastructure every year. And not only is that investment increasingly at risk from climate change, there are other critical risks undermining these investments. And let me just pause for a second. Does everyone see my screen really quick? Making sure it's displaying right. Is that right? Can you guys see this? Okay. All right. So again, we're talking about spending a lot of money, and there's a big missing piece here. 1 out of 5 projects globally are canceled or delayed because of environmental or social concerns of the community. It's a big number. You can do the math on what $1 trillion of investment in infrastructure will do. So for example, Miami Beach, their effort to raise roads resulted in 4 years worth of delays and lawsuits to stop the effort entirely. And why is this happening? Our information and community feedback loops between the public, the city, and solutions designers are broken. And there are three root causes. First, the data is not matching community experiences on the ground. As detailed in MIT's technology review last year, the machine learning models and the AI that we're building in a lab on computers don't work in the real world. We can't tell if they will. The model data that we're producing around flooding, heat, air quality, climate risk, it's failing in the real world. It's lacking granularity and context, and it's leading to design errors that we will live with for decades. For example, the rain intensity assumptions for Miami and New Orleans have been inaccurate. And that has resulted in multi-million-dollar HUD and bond-funded infrastructure projects being undersized and not placed in the right locations. So I see change is solving for that. Two, ground truthing the model data is expensive and insufficient. Field engineers can't be in the right places at the right times. The sensors that people are placing are easily broken or overwhelmed, and video cameras are missing context and details. So IC Change can solve for that too. And the biggest problem that we solve for, the most important in my mind, is that we are struggling with engagement, equitable engagement. We don't have a data problem. We have a people problem when it comes to climate. And our clients are struggling around engagement for climate risk at scale. They're working with PR firms and they're holding meetings that nobody goes to. And it's eroding public trust. And it's missing valuable insights that can be provided in partnership with our least resourced community members. And that's exactly what IC Change is solving for. We are a climate and engagement data platform in one. We're enabling our clients, who are municipalities, utilities, and engineers, to collaborate directly with the public on solutions. And we're using what we call climate feedback loops. We are complementing, bringing together in these public meetings, like again, we're getting to do right now, but we're able to centralize the insights and then repeat the engagement over time, providing critical missing insights, details, and trust that's missing in the infrastructure process. We've done this multiple times across multiple climate risks. So for example, in federally funded infrastructure projects like this one in New Orleans, we quadrupled public participation in low-income neighborhoods. That's compared to having those public meetings that nobody goes to. Residents tracked 29 flood events and proved that the models were underestimating risk. And as a result, we reallocated $4.8 million in flood capacity to this low-income neighborhood that you see here that wasn't receiving the infrastructure solutions it needed. What that means is that residents in the St. Bernard campus neighborhood here don't have to worry about losing their cars during 2-year rain events. A car is someone's second and often first most valuable asset, what they use to get to the grocery store, what they use to get to the doctor, what they use to get to work. And this neighborhood will be receiving the largest underground stormwater storage unit of its kind in the South. This flooding work has scaled to the city of Miami, where we are the city's official flood reporting tool. And just 2 months ago, we helped the city win $20 million in resilience investments from the state of Florida, demonstrating that inland flooding in non-English speaking neighborhoods is more severe than the stormwater modeling suggests. So again, this is how it looks. We are more than just flooding. Our community platform is used to model urban heat, air quality, drought, and ecological changes over time. Even the simplest posts generate a wealth of qualitative and quantitative information. Our platform provides real-time AI-enabled community-powered data, and we sync each post to local weather and sensor networks, heat sensors, flood sensors, purple layers. I think someone's going to be talking about purple layers soon, providing additional layers of context and model validation. We like to say that 1,000 IC Change users are more impactful than 1 million Instagram users, because we are producing the technical data and engagement that is missing in both our mitigation and adaptation solutions design. I know we're running short on time, so I'm going to run through really quickly. Posting is very similar to traditional social media, but we use AI to scan stories and suggest tags that open up quantitative data prompts. So this is the one we use for modeling storms and flooding, but we have different prompts for heat and air quality, zeroing in on the details and the context about health impacts that data alone can't tell us. We are an educational platform, so we do the temperature data, the precipitation data, the air quality data, and provide prompts to users to let them know, hey, this is an unusually warm day compared to the 30-year average. How have things changed for you locally? And we've used that to really drill into how we're doing warnings around National Weather Service heat alerts. Our work on heat has resulted in an understanding locally here that some of the most important levers we can push in terms of protecting people's health are actually health and safety housing regulations and energy efficiency programs. And that combined, those could be more powerful than public greening efforts in low-income neighborhoods. And I can talk about that in questions and answers. One last one here is that we are actually developing new applications on IC Change to co-design solutions. And I'm bringing this up as it relates to y'all at North Carolina Breathe. This is our first climate mitigation application. We're going to be using IC Change to site and construct EV charging stations in charging deserts in Chicago. And as we've been working with advocates there, the biggest consideration for them has been putting charging stations in areas where there are air quality issues and asthma issues. That's what the community wants. But we're also having to leverage the data and make sure that the charging station companies and the utilities are also getting the data they need to be able to maximize the investments. This is so exciting for us because all of the climate risks that we track, heat, flooding, air quality, have solutions. And this is the time to start using the community data and investment to make those investments. So looking forward to the conversation. Definitely check us out. This is our QR code. And definitely email me. I'm julia@icchange.org. We're open-armed collaborators. If there are public sector partners or specific projects that you all are interested in working on, we'd love to hear about it. Thanks so much.
Dr. Fry. Thank you, Julia. And Dr. Fry is up next.
Great. Can you see my slides and hear me? Wonderful. So thank you so much, Julie. I'm excited to reach out and talk to you about some of the things that we're doing at UNC. So again, I'm from UNC Chapel Hill in the Gilling School of Global Public Health in the Department of Environmental Sciences and Engineering. And I run a few of our efforts in environmental science there, the Institute for Environmental Health Solutions, which is focused on solutions to protect populations from environmental hazards. I run our NIEHS-funded Superfund research program. And I'm here today to tell you about a tool that we've developed that is called EnviroScan. And you can get to EnviroScan at enviroscan.org. And this is a web-based tool that is used to integrate chemical stressor data, non-chemical stressor data, and health endpoint data within North Carolina. And this, the idea for this was the brainchild of a team of scientists at UNC who came together from all over campus, where we were concerned about environmental contaminants and their effects on pregnant women and children. And the fact that we know that we're not simply exposed to one chemical in the environment, but many, and we're not only exposed to chemicals, but also other stressors that we know can synergize biologically with those chemicals influencing human health. And so this was funded through a COVID supplement from the NIEHS. And our goal is to develop a user-friendly tool to help North Carolina communities to increase their awareness of environmental and other factors that may influence their health, to be able to visualize trends in some of the environmental chemicals, sociodemographic variables, environmental justice factors, and health outcomes, and identify resources for potential solutions. Our tool continues to evolve. We launched recently after about a year in the works. And you'll see if you go to the tool that we have right now populated several data sets related to environmental indicators. So again, thinking about chemicals in the environment and the fact that they can be present in water, air, soil. I'll tell you a little bit more about that as I move forward. One of the primary data sets that we've incorporated here comes from a private drinking well water database that we've recently published called NC Well, where many of you may know that we have approximately 3 million people in North Carolina who are on private drinking well water, meaning that they don't get their water from public water supply, and also meaning that their water is not protected by the Environmental Protection Agency. And so we have analyzed toxic metals within private drinking well water and included that in EnviroScan so that communities and individuals can see patterns of contaminant exposure related to that. In terms of our currently populated sociodemographic indicators, we're including information currently from the census, but we have new initiatives at UNC to include data in collaboration with NC Tracks that would pull in information from the medical record system, so the EPIC medical registry. From the census data right now, we have race, ethnicity, linguistic isolation that we can use to examine trends within EnviroScan. And then we also have environmental justice indicators. And so what's been populated so far are 11 environmental justice indices that are derived from the EPA EJ screen. And so you can see here on the right a list of those that we've included: air toxic cancer risk, diesel PM, particulate matter, ozone. So we thought for this conference, it would be interesting for you to hear about some of these that we've populated. Let me give you an example. When you go to the website, you can click on the mapping tool, and then you can begin to examine some of the trends in our state and in your own community. So this, for example, is what the data look like if you select inorganic arsenic. And here the color coding is the dark purple would be census tracts where inorganic arsenic has been found to be high. We can overlay county boundaries so you can get a sense of our 100 counties and which of those have highest levels potentially of inorganic arsenic, again, in private drinking well water. And you'll notice here the central part of the state, the reason that inorganic arsenic is high there is that it's naturally occurring, it's naturally geologically occurring, and are geological formations such as the Carolina Slate Belt that contribute to this risk of high level arsenic contamination. I had mentioned that I run our NIEHS funded Superfund research program, and that this tool was actually developed through funding through that center. We also have Superfund sites in North Carolina. These are designated as the worst contaminated sites across the United States. We have about 43 of those, and they're indicated here. And so within the tool, you can also have, within this additional features, you can examine the location of, here you can see the Superfund sites are selected, but you could also look at, for example, proximity to hospitals or public schools. And we're, again, continuing to evolve this tool to include other overlays that would allow us to identify trends and solutions related to environmental issues. Within the sociodemographic indicators, I mentioned that we have several that we've pulled in through a census. So for example, here I'm showing you census tracts where there are a high proportion of the population that are below the poverty level. Here is a map of preterm birth risk across North Carolina. Dark green would be areas where preterm birth risk is high. And I will just quickly mention that related to the conference, I'm overlaying here showing you the patterns of environmental justice index, air toxics, cancer. I just want to highlight this one county, Robeson, as an example where we know we have potential for high level exposure and also significant populations in poverty. So I wish I had time to tell you more. If you have any questions, please feel free to reach out to me. We're excited about this tool and what we believe it can do to promote public health in North Carolina. Thank you so much.
And next will be Max Cawley.
Hey there, folks. It's really an honor and a pleasure to be here with all of y'all. It's an honor to share the platform with my fellow panelists. Julia, I think this is probably the fifth or sixth panel that we've shared together. It's always great to see you. Icy Change was a really important component of the campaign that I'll be talking a little bit about today. Back in 2021, about 165 volunteers, residents of Raleigh and Durham helped us to map heat expression across Raleigh and Durham. I'll be talking a little bit about some of those results today. You can go to the next slide. It's easy to think of heat expression just as a matter of physics or a matter of climatology. It is both of those things. Here in these slides, you can see daily maximum temperature under a few emission scenarios. You can go to the next slide. You can see days reaching at least 95 degrees. You can go to the next slide. Days reaching at least 100 degrees. You can go to the next slide. Days reaching 105 degrees. You can go to the next slide. Average daily minimum temperature. This is a pretty terrifying slide here. You can go to the next one. This one, I think, is one of the more terrifying slides that we have. Days reaching at least 90 degrees. Here in North Carolina, at least in Raleigh and Durham, we'd expect to see somewhere between 40 and 50 days a year that reach into the 90s. You can see under some emission scenarios, we may see over a third of the year reaching into the 90s by 2100. Currently, we can also contextualize heat as being a really important and powerful public health threat. Thousands of people die here in North Carolina due to heat exposure every year. And as we've just seen, this is really only going to increase with climate change. It is not only a matter of public health or of climatology. Heat is also one of the clearest expressions that we see of the painful legacy of racist policy and practices playing out as contemporary climate risk. Heat is also a matter of racial justice, it's a matter of economic justice, and it's a matter of social justice. Due to this really emergent community concern, we set about to attempt to map what heat looked and felt like across Raleigh and Durham, at least across 140 square miles of it. So we were part of last year's NOAA NIHIS campaign to take out sensors with citizen scientists from Raleigh and Durham, themselves residents. And it's an important reminder that science is a process and that it's always done by people. In this case, that was about 165 people that helped to map, carried around equipment. You can go to the next slide. Here's a few of them, myself in the middle. You can go to the next one. But it really brought together this really broad coalition of a whole bunch of different partners, a whole bunch of different stakeholders, and dozens more that helped us to beta test the equipment and also that helped us to understand what the routes ought to look like and what neighborhood and community priorities are. You can go to the next slide. The two sensors that we primarily took out, one is a thermocouple sensor. This was provided by NOAA NIHIS and Kappa Strategies. You can see that one on the right. And Pocket Lab sensors, which are the ones on the left, which we had people walk around with. So people drove, biked around, and walked around with these sensors. We actually have these Pocket Lab sensors here to keep at the institution I work at, the Museum of Life and Science. If anybody is interested in helping us figure out how we might scale this approach, I'd be really happy to talk to you after today's presentation. Here's a couple of looks at what sort of Durham looked like day of the campaign. We actually did not end up with a terribly hot day that we took these out on because of a compounding climate hazard, which was wildfire smoke from Oregon. So it actually ended up being a relatively normal day here in Raleigh and Durham. You can go to the next slide, and the next one. And the next one. So rather than an actual genuine heat wave, we ended up with a day that was more like 90 degrees, which was a typical July day here in the 2020s. You can go to the next slide. This is what the routes ended up looking like, at least here in Durham. So this was people driving and biking around Durham 3 times during the day, which we could then use to model that heat expression. You can go to the next one. What we end up looking at is areas with really, really high density planning and huge areas of urbanization. We end up typically seeing hotter, but it's really not so simple. You can go to the next one. You can actually see some really incredible granularity in some of these maps as well. For those of you all looking really closely at them, luckily for all of us, these are now also available as a public service of the North Carolina State Climate Office. You can find all of our data and these maps available there. You can keep clicking through here. Here is Moore Square here in the middle of Raleigh, and you can see that teeny tiny little 1 by 1 by 1 block. You can go to the next slide. Here's Durham's heat expression from 6 to 7 a.m. This was July 23rd, 2021, the day of our campaign. You can go to the next one. Here's the heat index from 3 to 4, typically the hottest part of the day here in Raleigh and Durham. You can go to the next one. And here is the evening. And of course, one really important takeaway is that the heat expression does not look the same. Evening is a really important one because people's options are very limited at night in terms of going to a friend's house, checking in on people, going to cooling centers. You can go to the next one. This is Raleigh's heat index in the morning. You can see that red scar, which is a very large road. You can go to the next one. Here's Raleigh in the hottest part of the day in the afternoon. You can go to the next slide. Here's Raleigh in the evening. Again, a really, really important thing to think about. Even though we didn't end up having our campaign day on a genuine heat wave, we still found an 11-degree difference between the hottest and coolest areas in Raleigh and Durham. This is a pretty significant finding. Like I mentioned before, Durham in particular was redlined. Raleigh was not, which does not mean that Raleigh did not have their own exclusionary and segregationist practices, but you can see how this plays out as contemporary climate risk. You can go to the next slide. Here is green-lined neighborhoods in Durham versus red-lined neighborhoods in Durham. This map tells a pretty clear picture of how this plays out. You can go to the next slide. This is from the community health assessment that we conducted in Durham prior to the campaign, which shows a lot of the social and economic vulnerability indices related to heat. This is kind of a complicated graph, but what you're looking at is census tracts that had formerly redlined neighborhoods compared to things like whether or not people had a car, whether or not people have health insurance, whether or not people live around tree canopy, whether or not people live around a whole bunch of impervious surfaces. With one tiny exception, all of these census tracts performed worse than the county average for Durham County. You can go to the next slide. This is my last one. What we know now is that with only very small exceptions, they all are physically warmer, all of these census tracts, at least in the afternoon. This is new data that we are plugging into Durham's Neighborhood Compass, thanks in large part to DataWorks NC. And what you're looking at there is the heat expression in those census tracts that had formerly redlined neighborhoods, all of which in the afternoon are, like I said, physically hotter. One last plug, we are having a collaborative heat hack. So again, all of these data are available for your use, but we are looking at what we might do together with them. This is in collaboration with Angel Shu, whose research at UNC was really important in showing that people of color across the United States are disproportionately burdened by extreme heat compared to white people. This hackathon is occurring later on this month, and I'm happy to talk about it later on. Thanks for giving me a few extra seconds.
Eric?
Well, first, thank you to Clean Air North Carolina. This is the second NC Breathe conference I've been to, and so my journey started with Daily Breath, recognizing that environmental factors as a determinant of health had been really neglected by the medical community, and it really wasn't incorporated into the fabric of care. But what really triggered my passion, I don't have asthma, nobody in my family has asthma, but what triggered my passion was this story several years ago before I launched my first kind of MVP. Doctors can't pinpoint what triggered 15-year-old asthma attack. The young girl portrayed here, 15-year-old young black girl, they were actually going on a family vacation, went from Nebraska to Iowa to go to an amusement park around July 4th. And I'm sorry. Okay. Long day at the amusement park, hot, humid, pesticides, agriculture products, all that kind of stuff, pollutants, obviously. Goes back to the hotel, ultimately goes to the pool. Chlorine is a kind of an irritant that causes an asthma attack. She's down for 20 minutes. She's paralyzed, paralyzed is unrecoverable. And this really just struck me as, why are we trying to pinpoint triggers after the attack? And so these are potentially preventable asthma attacks, okay? And so that was the premise behind Daily Breath. Can we pinpoint triggers, and by doing that, create a personalized health model for helping people avoid asthma attacks? Next slide. So one of the benefits of this, we pinpoint triggers two-way. One, we try to explain the air quality, the pollen, the weather variables that are actually impacting the patient on a personal level. We want to create a personalized health model. So we want to generate basically real-world evidence that drives an algorithm that informs them of what their own personal risk is. But at the same time, we're actually able to capture the location. What's unique about this is then it provides another filter for the individual from a risk perspective, but it also creates a crowdsource function where you're basically tracking people's symptoms in a community. And because these things are related to either pollen or, in this case, pollutants, you can actually track where potentially people are being impacted by specific types of pollutants. Now, we've talked a lot about air quality and pollen here, too. I started this journey about 3 or 4 years ago, thought basically we had readily available pollutant information or pollen information, and that's really not the case. So we have to get much more granular. We have to have much more localized data to actually have these types of models work really, really effectively. But this is a map kind of on Daily Breath, the mobile app. And ironically, India seems to be our greatest accumulator of downloads right now. They obviously readily understand the pollution there. But what's occurring here is green is kind of allergy, so it's pinpoint, right, the pins. Green is allergies, blue is asthma, and purple is allergic asthma. 70% of people who have asthma have allergic asthma. I think this is kind of unique in some ways because we can actually potentially start to track via heat maps specific pollutants, and then by doing that, literally track symptoms associated with, for example, traffic corridors or specific communities from a housing perspective. And so I think there's an opportunity over time to actually implement asthma management programs in those communities, as well as identify those communities as places you target for climate change mitigation activities or clean air activities. Next slide. 2 minutes, Rob. Sorry. So last slide, basically, this is kind of a QR code for the iOS version as well as the Android version. It's the asthma app is focused on your environmental triggers. I have a table outside with a lot more information about the free version, the paid version. We even are the only asthma app that tracks wildfire smoke. And so I encourage people to download it, and I look for a lot of opportunities for collaboration. I'm looking for academic research opportunities, grant opportunities, and those types of things. And thank you for letting me be here.
Sure. All right, and our last speaker here before Q&A is Ron Ross.
Thank you. Good afternoon. Richard, may I borrow your hat? I'm a little cold here. I'm Ron Ross from Northwood Estates Community Organization in Charlotte, historic West End, Green District. Next slide, please. Real quickly, you've heard a lot about the redlining map. It shows in the red areas, the disinvestment areas that financial institutions refuse to make loans, again, governmentally mandated. And again, go to the next map, no, not the next page, next map. It shows the health disparity that exists in Charlotte, and it affects, you got unemployment rates that are affected, access to fresh and healthy foods. And these inequities make residents more vulnerable to the impacts of extreme heat and weather events. And also, again, where you live, you're affected by the social determinants of health and one's life expectancy. And by experiencing these exposures, one can be at greater risk despite experiencing the same exposure. So if one person lives in a affluent area versus one that lives in a low-income economic area, the pollution levels may be the same, but based on where they are located in close proximity to industrial facilities, highways that emit these pollutions, they will have result in a negative impact upon their health. And that map on the last page there is reflecting polluting sites that are located in Charlotte. Again, toxic waste sites, again, higher proximity to air polluted areas. Next slide, please. And as a community, understanding and addressing challenges through community monitoring, we executed monitoring efforts in 2017 with purple air monitors, and where this is our purple monitor there that's located in front of our residences. That's where we had them posted, and they measured levels of PM 2.5, and the picture there is one of our residents and some individuals with clean air. Next slide, please. This is an example of a screenshot of a purple air monitor that is reflecting the monitors that were in the neighborhoods that I live. Again, it's live data. It reflects the air quality index for that particular moment. And we noticed that during different times, peak times, the fluctuation was related to trucks that were passing through the community. Also, one real big notice was that during the day in the neighborhood, they were laying asphalt in the neighborhood, so that spiked the percentage of air pollution in that area. And as a side to that, one of the items that we drew from that would be that we wanted to have the community, the city utility companies to notify the neighborhood when they would be coming out to do those types of work within the community so that the residents would not be exposed to that. Next slide, please. And in conjunction with Clean Air Carolina, we were able to do air quality monitoring again since 2017, which resulted in a report that reflected the air quality readings for those 2 years. And this report covers work that involves citizen scientists collecting the data, and as a result of that work with the residents, we were able to provide presentations to our city and county government officials as to the results of that data. Again, there was pretty much the data that revealed the pollution levels were pretty consistent, even in the lower income areas as well as the more affluent areas of Charlotte. But again, just where they were located, our communities were in close proximity to the industrial facilities, and those made that difference. And we were able to advocate to our city and local government officials about the discrepancies, and through those advocacy processes, we were able to obtain a federally government monitoring apparatus that operates on or calculates 2.5 particulate matter. Next slide, please. And in our community, historic West End Green District, we're wanting to build upon monitoring, continue building upon our monitoring efforts to increase and foster our advocacy around data inputs, reduce impacts of air pollution through the implementation of increased tree canopy and green infrastructure. We want to increase our community's understanding between the connection of poor air quality and health. Again, we want to have collaboration with our community and get their input and insights. And again, engage the community, engage the city and county and other partners around our efforts. and lead and provide models for other impacted communities. Next slide. And in closing, we would just like to say again, we have been very successful in starting to implement a green district in our communities. We wish to continue improving air quality in our community, continue to offer solutions to reduce carbon emissions and improve health outcomes, and also improve the quality of life of our residents. And thank you very much. And again, a very big special thanks to Clean Air NC for their efforts and also the collaboration within our community. Thank you.
You want to stay there? Okay. You want to stay there for a second? I'll ask you the first question. So now we'll move into the Q&A portion here, and Ron gets the first question. Do you want to build on the education around purple air data and air pollution impacts and how that's led to actionable efforts in your community? Would you like to build on that some more?
Yeah. Well, one of the things that we've been able to do, again, we're looking forward to create a historic West End Green District. And what we've been able to do, due to the report that we obtained and the information we obtained due to the monitoring information we got from the implementation of the purple air monitors. Again, one, we were able to get a air quality monitor in our communities, and also the, excuse me. Okay, just froze up, I'm sorry. Yeah, sorry. Yeah, so one of the things that has led to us, again, we're trying to reduce the pollution again because we got the freeways in our communities, is that we have led a charge to start infrastructure, EV charging infrastructure in our communities. And so one of the recent success stories has been that we were able to join forces with UNC Charlotte, City of Charlotte, Centralina, and Duke Power Energy. And through those collaborations, there was a creation of a pole vault EV charger. Again, it's the first one that was created in the United States. And what it is an EV charger that is attached to an electric pole versus being a standalone facility. So we're leading that charge. We're also leading the charge to have additional EV charging stations along our corridor at the library, public library. We have the city implementing charging stations in a Vest water plant, and we have some local businesses that are leading that charge as well. As well as we have some wins with creating green infrastructure in our community. We've just been able to get awarded some funds to create green pillars with vegetation highlighting the ending and entrances to our community, highlighting our green district.
Great, thank you.
Thanks.
And the next question we have is for Eric Kloss, founder of Daily Breath. Daily Breath provides individual health predictions based on environmental factors, and hence is a very personal app. But can the tool also be used to advance health outcomes at the local or state levels?
That's the hope. I think crowdsourcing of symptoms permits you to see on a map where specific types of conditions are being impacted by environmental factors, even at the pollutant level. And so that's where I think over time you can develop. Right now it's just pins, but you can see developing heat maps associated with specific pollutants that are impacting a particular individual. And I think that's where the opportunity really to extend this from just not only addressing individual health, but also looking at community health. And I think, what I've noticed as I looked at asthma is a community of people who have a particular unique condition, but they also experience that condition at a local level. And so you have a unique opportunity, I think, to bring crowdsourcing into that framework of each of the individuals contributing to kind of the public good by helping their fellow, similar patients like me, right? So that's where I think the opportunity is.
Great, thank you.
We're running just a
Yeah.
little behind. And we wanted to try to bring Jacoby back in to see if he had anything to say,
Sure.
if we could do that.
Sure, sure.
Carol, do we have?
Is Jacoby Wilson still on?
Yep, he would bring him back to make just some wrap-up comments.
Sure, sure, sure.
I'm here.
2 or 3 minutes here, or wrap-up comments, please.
Oh, for me. Oh yeah, it was great hearing the panelists today. I think again the technology and apps are very important for us to advance environmental justice and public health. I think one of the things I would just encourage folks to do is make sure you actually have engagement of the impacted populations in the development of these tools. You need to have participation feedback loops. Meaning 17 principles of environmental justice, to the principles 5 and 7 about self-determination, the community speaking their own voice. So you have to make sure the people that are most impacted are actually at the table in the development of the tools to make sure they're stakeholders, right? They're informed experts, they're contextual experts. So I would want to emphasize that. Love the work in Charlotte, love hearing about what's happening. I would say make sure your mayor is engaged with state agencies to make sure that they're getting that infrastructure dollars, legacy pollution sites, mass transit, electrification dollars are in that money. So that's money that can come down to the state. I would like to see North Carolina have a J40 work group. Do you have a Justice 40 working group to make sure that your dollars are actually going to the communities with the most need? You right now, you already have a North Carolina EJ screen tool. So when I heard Dr. Frost said they're building the tool, why do y'all have two tools? Is there interoperability between the two tools? Have y'all engaged? Is the EJ work group, Dr. Frost, are y'all talking to that work group to make sure these tools are actually working together? Because again, the community's voice needs to be heard. And I love the climate change work that Julia's doing. I think that level of data is a kind of hyper-local data we need to really inform decision-making. So I'll just encourage everybody to keep up the great work and just make sure that what you're doing is of the community, for the community, by the community. Thank you.
All right, and that's all we have time for us right now. And hopefully you can, I'm sure there are lots more questions. Please meet the panelists and speakers during our lunch break. Thank you again.